Have you ever wondered what your heart is actually saying? I mean, beyond that familiar thump thump. Today, we're diving in and learning the language of the heart. We're going to decode everything, from the simple pulse you can feel in your wrist all the way to the invisible electrical signals that run the whole show.
Just think about that number for a second. Over 3 billion signals. Every single one of those is a tiny message about what's going on inside your body. So, are you ready to learn how to read them? Let's get into it. All right, so where do we even begin? We're going to start with the most basic, tangible sign that the heart is doing its job, the pulse. That rhythmic beat is our very first clue, our starting point for any kind of cardiovascular assessment.
Now, this slide is like a roadmap for checking blood flow across the entire body. You've got the carotid artery in the neck, the brachial in the arm, all the way down to the posterior tibial near the ankle, and the dorsalis pedis on top of the foot. Checking these spots gives us a really clear picture of how well blood is getting around. A nice, strong, regular pulse at all these points, that's exactly what we want to see.
Okay, so feeling that thump-thump is one thing, but what's actually making it happen? Well, the answer isn't something you can see or feel. It's hidden in the heart's invisible electrical blueprint, its conduction system. Let's pull back the curtain and see how it all works. Everything, and I mean every single normal heartbeat, starts right here, in a tiny little spot called the SA node. You can think of it as the heart's natural spark plug. It's the command center, firing off an electrical impulse between 60 and 100 times a minute, setting the pace for the entire heart. And this is what that electrical signal actually looks like on an ECG. It's called the PQRS waveform, and every little part of it tells a piece of the story. You see that first little bump, the P wave? That shows the atria, the top chambers, squeezing. Then that huge spike, the QRS complex, that's the big, powerful ventricles doing their thing. And the final T wave, well, that's the ventricles resetting for the very next beat. It's the whole story of one heartbeat, right there in one line. You know, reading this blueprint isn't just guesswork. It's not about looking at some squiggles and taking a shot in the dark. Experts use a very systematic method, like this one here, to analyze every single piece of that waveform. They're checking the rhythm, the rate, the exact shape of each wave, making sure that electrical system is firing on all cylinders. But of course, sometimes that electrical blueprint has a flaw. When those signals get mixed up or disrupted, we get something called an arrhythmia. And that's just a way of saying the heart is beating too fast, or maybe too slow, or just plain irregularly. So the two most common arrhythmias are bradycardia and tachycardia. And I love the way our source material explains this. Think of the classic story. Bradycardia is the tortoise. It's a heart rate that's too slow, dragging along at less than 60 beats a minute. And tachycardia? Well, that's the hare, racing way too fast at over 100 beats a minute. Now, a fast heart rate can go from just a little speedy to really dangerous. This right here is ventricular tachycardia, or VTAC. Just look at how wide and weird those QRS complexes are. What's happening is the ventricles are beating so incredibly fast they don't have time to fill up with blood. And if they can't fill, they can't pump oxygen out to the body. This is a huge medical emergency. And on the total opposite end of the spectrum, you can have a pause. This is called sinus arrest. Do you see that flat line right there in the middle? A whole PQRST complex, an entire heartbeat, is just gone. It's a scary moment where the heart's natural pacemaker, that SA node, just failed to do its job. Okay, so we've looked at all this electrical stuff, right? The normal signals, the abnormal ones, the squiggly lines. But how does any of that connect back to what a doctor or nurse can actually see and feel on a real person? Let's connect those dots right now. So here we have a typical note from a cardiovascular assessment. At first glance, it probably looks like a bunch of confusing medical jargon. But guess what? After everything we've just learned, we now have the key to decode it. Let's go through it line by line. First up, inspection. This is simply what you can see with your own eyes. No cyanosis means the skin has a healthy color, not bluish, which tells us there's good oxygen in the blood. And no JVD, that means the veins in the neck aren't bulging, which can be a sign of pressure backing up from the heart. So visually, everything looks good. Next is palpation, or what you can feel. There's this super quick but really clever test called capillary refill. You just press on a fingernail for a second till it turns white, then see how fast the pink color comes back. If it's less than 2 seconds, that's a great sign that the heart is pumping blood efficiently all the way out to the fingertips. And here it is. This is the big payoff. When that note says pulses +2 equal bilaterally,
It means all those pulses on our body roadmap are strong, steady, and the same on both sides. This physical finding is the direct, tangible result of that perfect, healthy electrical blueprint we saw in the ECG earlier. It all connects. And finally, auscultation, listening with a stethoscope. That classic lub-dub sound, that's noted as S1 and S2. And hearing that clearly tells us the heart's machinery, its valves, are opening and closing perfectly in sync with the electrical signals. When the note also says the pulse is 72 and regular, well, that's our healthy blueprint in action. But what if the rhythm is lost? What happens when those signals go haywire and the physical signs start showing that there is a problem? Well, the good news is, medical science has come up with some pretty incredible ways to step in and restore that rhythm. Basically, there are three main tools in the toolbox. First, you can use medications to chemically calm down and stabilize the heart's electrical system. Second, you can use an electrical shock, like defibrillation, to basically hit the reset button on dangerous rhythms. Or third, if the heart's own pacemaker just isn't cutting it, you can implant an artificial one to take over. And this right here is a perfect reason why someone might need a pacemaker. It's called an AV block. It means the electrical signal gets delayed or sometimes completely stopped on its journey from the top of the heart to the bottom. It's like a communication breakdown in the heart's wiring, and a pacemaker acts like a new wire to get that message through. So, how do they do it? This quote explains it perfectly. A pacemaker has its own little power source. It generates an impulse and sends that signal directly to the heart muscle, telling it when to squeeze or depolarize. It's really an amazing solution that just takes over the job when the natural system can't. So think about how far we've come. We went from just feeling a simple pulse, to seeing the complex electrical signal, to diagnosing its flaws, and even using technology to rewrite the heart's code. It really makes you wonder, with this incredible ability to both read and correct the heart's most fundamental signals, what on earth does the future of cardiac health even look like?